How long can you take prednisone safely? Is there a time period where it's like suddenly more dangerous? Is one dose enough to cause terrible side effects? Hi, I'm Dr. Megan, your prednisone pharmacist. I'm here to answer those questions for you. I personally had to take prednisone, so I know what it feels like. And I know that struggle between it's helping, but how long can I be on it safely, right? So I got this email from a prednisone warrior and it says, "Hi, Dr. Megan. I've been trying to taper to 0 for about 2 years. I've gotten down to 1 milligram and had to go back up twice due to polymyalgia symptoms. I'm at 2.25 milligrams right now, tapering every 2 weeks by 1/4 milligram. How dangerous is it for me to stay on prednisone? Is it okay to take 3 to 5 milligrams forever?" This is a really understandable question because this condition, PMR, polymyalgia rheumatica, is completely debilitating and miserable. And 3 to 5 milligrams isn't much. It's only just barely above our naturally occurring amount of cortisol, which is the hormone in our body that prednisone is mimicking, which our body makes somewhere between 1 to 2.5 milligram equivalent of prednisone. Can I do that? Can I just keep taking that amount? Is that safe? It's a tricky question because essentially there is no safe dose of prednisone and no amount of time that prednisone is considered safe. If you're going to go by strictly, does it cause side effects or not? One dose, 1 milligram is enough to cause side effects. But that's not the real question here. The real question is it okay to take it forever? And that's really a question of, do the benefits outweigh the risks? Now, you have to talk to your doctor about the benefits because I can't tell you what those are in your situation because prednisone can be used for almost anything from autoimmune diseases, allergic reactions to kidney transplants. So you have to know precisely what the benefits are for you. What I can tell you is what are the risks, because then you can make a more educated decision of what the benefits versus the risks are. And so, what are the risks of staying on prednisone forever? So, I personally took it for 9 months, and these are the side effects I personally suffered. They were no fun. I don't wish this on my worst enemy, but it was necessary for me. I had a bleeding disorder where I could possibly bleed to death if I hadn't taken prednisone. So, bleeding versus these side effects, definitely don't want to die. That's what I went for. And so it's understandable. I really definitely understand the need to get off of prednisone and also the need to stay on prednisone. Prednisone is a miracle and it makes us miserable. So basically, what are these risks? So let me share you what the duration dependent side effects are. With prednisone, some side effects are worse the higher the dose, and some side effects are worse the longer the time you're on them. Basically, the milligrams over your lifetime, how many milligrams of prednisone you get, whether it's 3 milligrams a day for 3 years or 300 milligrams a day in one day, right? Either way, that's a lot of prednisone. And so, does it matter? So, let me tell you what the duration dependent side effects of prednisone are. First of all is Cushing syndrome or moon face, the big fat belly weight gain, the possible movement of fat to your neck area, the back of your neck. That's called the buffalo hump, and just body fat accumulation in general. That can happen within 2 months of treatment. That doesn't generally happen within the first few days. It's something that happens more longer term. And even at 5 milligrams a day, you can have it. Is it worth it to have a rounder face and also be able to function? Good question. But this increasing duration of use was significantly associated with weight gain. So the longer you're on it, the more likely you are to gain weight. It's just one of those things to be aware of. So that's the first one, is weight gain or Cushing syndrome. Second is mood changes or neuropsychiatric side effects. So after just one dose, you can have this amazing improved sense of well-being, this euphoria, this just, life is great. I feel like $1,000,000. And then longer term, you can have other side effects from anxiety to hypomanic reactions to depression. Depression is the most common side effect, mood change side effect, long term. So it's possible you might have more depression the longer you're on prednisone. Number 3 is heart disease. Prednisone can be rather hard on our heart because essentially prednisone is mimicking this cortisol that is designed to help us survive a threat, whether it's of war or famine. And it's basically stealing from all the reserves in our body, like our bones and our muscles, to get through that short period of badness, because it's better to survive than to like have a strong heart or strong bones. So it's cutting corners, right? So your risk for heart disease is increased. Risk for high blood pressure goes up long term, arrhythmias, heart attacks. You can have cardiovascular risks at even less than 5 milligrams a day. And overall, you're more than 2.5 times more likely than patients who did not receive glucocorticoids to experience a cardiovascular event. So it's 2.5 times more likely to have heart problems if you had never taken prednisone than if you had. Next, they did a study of 327,000 adults in the United States who had to take prednisone. And this was basically just to see what happened in the first 30 days after treatment. What was more likely for people who had been prescribed it versus the 30 to 90 days before. So they were looking at insurance records, and they saw that in the first 30 days, you're more likely to have a VTE, which is a venous thromboembolism or clot. You're 3.33 times more likely in the 30 days after you took prednisone than the 30 to 90 days before. And then osteoporosis, 1.88, or almost 2 times more likely to have a fracture, a broken bone, the first 30 days after taking prednisone than 30 to 90 days before you had taken it. And the third thing they looked at was infections. So the worst kind of infection is called sepsis, where it's like your whole body is infected. And that was a 5 times greater risk after taking prednisone. Prednisone is causing immunosuppression. Prednisone is not safe. There is no safe dose of prednisone. There's no safe time of prednisone. These things can happen. Next is diabetes or glucose intolerance. Your relative risk increases from 1.8 in patients treated with the equivalent of less than 10 milligrams a day. So you like have almost a 2 times greater risk if you're on less than 10 milligrams a day. And it increases up to 10.3 in those with the equivalent of 30 milligrams a day or more of prednisone. So anywhere between a 2 to 10 times greater risk of diabetes if you're on prednisone. Finally, cataracts or glaucoma, side effects in your eyes. The longer you're on prednisone, the greater your risk for cataracts, which is like clouding of your lens of your eye, increased pressure in your eye. Those get worse the longer you're on prednisone. So basically, now you know the main side effects to be aware of. There's no safe dose. There's no safe time period. It's all a benefit risk calculation for you. Is prednisone worth it? Is it going to keep you functioning as a happy member of society or not? And if so, this is the price you're willing to pay in increased risks of all of those side effects. Is it worth it? It was for me. I was really grateful for the chemotherapy I was able to go on to get off of it so that those risks went way down. But there are some things you can do to decrease your risks. And one of those things is replenishing the nutrients prednisone is depleting. So the osteoporosis is because prednisone is depleting calcium and vitamin D and magnesium and vitamin K2, and it's making it so your bones are becoming thin and are more likely to break, right? You have a 1.88 times greater risk of fracture. And so if we replenish the calcium and vitamin D and magnesium and vitamin K2 and folate and all the good things, that's theoretically going to decrease your risk. And in fact, they did a study. If all you did was to replenish calcium, you're not as likely. It wasn't any better than if you'd done calcium and vitamin D. So it's more important to have the vitamin D together with the calcium to decrease your risk for osteoporosis from prednisone. And you can't just do the calcium. You got to do these other nutrients to make it work. But it's not just osteoporosis that you can decrease your risk by replenishing nutrients. In fact, the diabetes is likely affected by the fact that prednisone is making us deplete our chromium. So we need to replenish chromium as well. And then the heart disease has many factors, but there is a lot of nutrients depleted that have impact on your heart. So prednisone is causing all these side effects by stealing from your reserves. And so we need to give it back. And if we give it back, we replenish the nutrients depleted, it's going to help our experience on prednisone for whatever time we need to be on it be safer. There's no safe dose, but it can be safer if you replenish. And so if you're thinking, oh my goodness, how am I going to figure out all the things I need to replenish? Well, don't worry. I did that for you because I was thinking, I don't ever want to be suffering all of these horrible side effects while on prednisone. So what I did is I invented Nutranize Zone. It's the first and only supplement for people on prednisone. It replenishes the nutrients that prednisone depletes and helps you feel better. And I made it in this handy dandy twin pack. So all you have to do is take 2 in the morning of the morning bottle and 2 at bedtime. And it helps you to get restful sleep, to support your bones and your immune system and your blood sugars. So you can decrease your risk as much as possible. I can't say it's going to cure any of those conditions, but it's going to support you while you're on prednisone. So you can just go to nutranize.com, nutranize.com, and get this. Take it while you're on prednisone and for at least 3 weeks after to support you while you're recovering from taking prednisone. Signing off is Dr. Megan, your prednisone pharmacist.